I'm Dr. Steve Teitelbaum, and you're watching the Plastic Surgery Channel.
Hi, I'm Dr. Bill Adams, Chief Medical Officer of the Plastic Surgery Channel, and welcome to PSC Hot Bites, our newest program where the channel's experts cut to the chase and provide real answers to questions you want to know on hot plastic surgery procedures, topics, or technology. We want to dispel the myths and marketing spin that often plagues patients and help you get the real story from our credible team. Joining me today via webcam is Dr. James Grotting from Birmingham, Alabama. Jim, great to have you on with us.
Thanks, Bill. It's great to be here.
So, Jim, I have a few questions for you, but you're a real expert in breast surgery. You've written textbooks on this subject. There are a lot of patients out there who have breast implants that are really too big for their bodies. What can you tell our viewers about the treatment of the over-augmented breast augmentation patient?
Well, Bill, it's a more and more common type of patient that we see. You know, years ago, patients oftentimes would go into breast augmentation with the misconception that bigger is better. And quite honestly, plastic surgeons were willing to put in quite large breast implants, and oftentimes they look good for a period of time. But the problem is that over the years, the implant can put considerable stress on the breast tissue. And with the effects of gravity and weight, the breast gradually drops on the chest wall, and the tissues can become stretched out so that after a few years, the breasts don't look so good anymore. And the other thing that can oftentimes happen to women after several pregnancies or after the years go by is they can gain some weight possibly, and this additional bulk then leads to a lowering of the whole breast on the chest wall. But fortunately, there are some very, very good solutions now, surgical solutions to correct this.
Jim?
The most common thing that we do now is we remove the old implant and we put in a smaller, more appropriate sized implant, and we do a short incision lift procedure. And the advantage for women who have very large saline breast implants is that by removing the saline from the implant in a very easily done clinic procedure, whereby we simply put a small needle into the implant, evacuate the saline, that allows tissues to shrink back up on their own. And by allowing the breast to shrink back up and lift itself over a period of 3 or 4 weeks, it makes it easier then to go back in and do the definitive operation, which is remove the old implant and do a lift, and then use a smaller, more appropriate sized implant, oftentimes silicone gel, in patients that still need a little bit more size.
Well, that's great information. I certainly guess the message is maybe bigger is not always better, and I think that there are a lot of those patients out there, and I think our viewers will find your pearls very, very helpful. So Jim, I really want to thank you for taking time out of your busy day to visit with us.
You're welcome, Bill. Thank you.
And we hope you enjoyed this segment of PSC Hot Bites, and be sure to get your next bite on our website, theplasticsurgerychannel.com. Until then, we'll see you soon.
I'm Dr. Steve Teitelbaum, and you're watching the Plastic Surgery Channel.